Hi, I'm Shanmugapriya, working as a lecturer in SNS College of Allied Health Science. Today we are going to see about breathing circuits. These breathing circuits are the tubings that connects the patient to anesthesia machine through airway. It enables a patient to breathe satisfactorily without significantly increasing the work of breathing or physiological dead space. It is designed to allow either spontaneous or controlled ventilation. There are basically three types of breathing circuits, which includes open system, semi-closed circuits, and closed circuits. We have another type called as semi-open system, which slightly differs from open system. So first we are going to see about open system. These open system where the inhalational agents are directly poured into the patient's mouth or nostril. In earlier days, we used ether and chloroform as inhalational agents. We also have disadvantages in open system where the delivered concentration cannot be controlled, and it also causes uncontrollable theatre pollution. In semi-open system, we have which is similar to that of open system. The folded towel is placed over the Schimmelbusch mask to prevent the escape of inhalational agents. And then in semi-closed circuits, we have mainly five components: APL valve, fresh gas supply, corrugated tube, reservoir bag, and the patient end. In the picture, FG indicates fresh gas supply and P indicates the patient end. Semi-closed circuits. So here the rebreathing is increased due to fresh gas supply is low, and then the expiratory time where the expiratory time is low and the inspiration is prolonged. So recommendations for fresh gas flow for each circuit is that the fresh gas flow should be sufficient enough to push the expired gases out in the atmosphere through expiratory valve before getting delivered to the patient. Basically these semi-closed circuits are divided into six types by a scientist called Mapleson. After him, these circuits are named as Mapleson circuit. Type A is also called as McGill circuit. We have type B, C, which is called as water circuit, D circuit, E circuit, which is called as Aries-Tepees, and F circuit, Jackson and Rees circuit. Next we have this picture depicts six types of Mapleson circuit, and the next one is type A called McGill circuit. Here in spontaneous breathing, the recommendation says that fresh gas flow should be equal to that of minute ventilation, and in controlled ventilation it should be equal to or 3 times of minute ventilation, which is greater than 20 liters. So we require high flows. This McGill circuit is a circuit of choice for spontaneous breathing. Lax system is a modification of type A. It is a coaxial circuit. Here the inner tube is expiratory tube and the outer tube is inspiratory tube. We have type V, where the fresh gas flow inlet is brought near the APL valve. It is equally efficient for both spontaneous and controlled ventilation. We have no advantage in type B. And the next one is type C. It is also known as water circuit. Here the corrugated tubing is shortened. It is equally efficient for both spontaneous and controlled ventilation. Here we have no advantage, therefore it is not used nowadays. And the next comes type D. Here the APL valve is brought near the back. Type D's coaxial modification is called as Bain circuit. Here the inner tube is called as inspiratory tube and the outer tube is expiratory tube. It is most commonly used circuit. The choice of tube for controlled ventilation. Fresh gas flow is equal to 1.6 times of minute ventilation, where the respiratory rate is 10 to 12 breaths per minute. And when the respiratory rate is 16 breaths per minute, it should be equal to 70 to 100 ml per kg per minute. And for spontaneous breathing, the recommendation of fresh gas flow is equal to 2.5 times of minute ventilation. Then for type D, we have some advantages and disadvantages. So the advantages are lightweight, it is used for head and neck surgeries, the resistance is less, and sterilization is easy. Disadvantage is that the inner tube gets kinked or folded, causing obstruction. So to avoid this advantage, the outer tube is made transparent. Next we have type E. It is called as Aries TPs. We have no APL valve and reservoir bag. So it is called as incomplete circuit. It is only used for spontaneous. If it is used for controlled ventilation, we can use it by intermittently occluding the end of expiratory limb. And next we have type F, which is a modification of Aries TPs, called as Jackson and Rees circuit. It is made complete by attaching a breathing bag, and it is also a valveless circuit. It is most commonly used in pediatric cases where the children below 6 years or below 20 kgs. And for spontaneous breathing, the recommendation for fresh gas flow is equal to 1.6 times of minute ventilation. And for controlled ventilation, the fresh gas flow recommendation is 2.5 times of minute ventilation. Semi-closed, here we see the efficiency of semi-closed circuits, and for spontaneous breathing, A is greater than DEF, which is greater than BC, and for controlled ventilation the efficiency is DFE is greater than BC, which is greater than A. And other examples of semi-closed circuits include Hafina system and Hampray system. Here the Hafina system, where the expiratory valve is replaced by suction port and ejector flow meter. So in the next class we will see about closed circuits. Thank you.